So today I will be dealing about the anatomy of the breast, that is the mammary gland which is helping for the production of the milk, and also the normal function, how the milk is being produced. That is called physiology of lactation, and I am going to tell you what are the different types of breasts or shapes of breast, are they affecting the lactation, and what are the different types of nipples. Okay. So you all know, right, this is the mammary gland or the breast tissue. So before going into everything, you can't directly say the whole breast tissue is having some problem. There won't be the whole breast tissue will be affected. Any part of the breast tissue might be affected. So to know that, we have to divide it into 4 quadrants. Okay, upper inner quadrant, lower inner quadrant, upper outer quadrant, and lower outer quadrant. So this is how. So if any mother is having any problem, so how you are going to note it down? She is having the pain in the lower outer quadrant. So that is how. So which lobule is going to be involved, where you are going to do the massage. So these all will be understood by dividing the breast into 4 quadrants. Okay, and you can see there is some tail extending upwards, right? Yes or no? So that is called axillary process of Spence. So it is also a breast tissue. Sometimes mother will not say pain in the breast, she might say pain somewhere towards the axilla. So at that time you should understand, is it really from the axilla, or there is some problem at the breast, she is having pain in the axilla. So that is the reason you need to know the basic structures involved in it. So where we are going to work on it. Okay. So now this is very normal thing, everybody knows, but I am just trying to remind you all these things. So from where the breast is present, it is present in the anterior chest wall, and it is extending from which rib to which rib? Vertically from the 2nd to 6th rib. Okay, from the 2nd to 6th rib. So then you should know where you are going to palpate if there is some problem, where you are going to ask the mother. So for those things you need to know the extension of the breast, and from horizontally it is extending from the lateral sternal line. You know, like sternum, you know, right? So you are all first year, second year, third year, final year BSc nursing students. You should know right now what do you mean by a gland. So am I clear to the last benches also? A gland is something which is secreting things, right? So that is the reason this is known as a mammary gland. Mammary gland secreting the milk. Okay. So most of the gland, so the okay. In the physiology, I will be discussing how the gland is formed, from which stage to which stage. But now we need to understand that there will be 15 to 20 lobules within the breast, okay, and which is supported by the breast tissue called the stroma, muscles and everything. The whole breast is, most of the breast during the pregnancy and the breastfeeding time, it will be occupied with the glands. Otherwise, it is having the stroma, fibrous tissue, connective tissue, all these things which are supporting the glands. So this is about the internal anatomy. So internally there are lot of lobules and lot of lobes, 15 to 20 lobes and lobules. These lobules will have an alveoli. This alveoli will open into lactiferous. Lactiferous ducts towards the nipple, they join with a lactiferous sinus and they open into the nipple. Okay, this is how the internal anatomy. So you need to know what is the function of this lactiferous duct and sinus. So the milk which is secreted within the alveoli will finally come and stay within the lactiferous sinus that is present just behind the areola. I don't have this slider. When you see the lactiferous ducts are there, right? So those ducts, before they are opening into the nipple, within the just behind the areola, they will be formed into sinus. Each duct will be formed into sinus, where actually the milk will be stored before just giving milk to the baby. So whenever the mother is not feeding baby for a long time, especially during the initial days of her breastfeeding, what happens, this milk becomes thickened and expression will not come. The let down will not happen because there is some obstruction because of the thickening of the milk within the lactiferous sinus. Now when you are trying to help the mother, she is having the full breast, but the milk is not coming down. She is having pain. So you should understand where might be the obstruction, what might be the cause. So one of the causes blocking of the lactiferous ducts at the sinus place. So if you clear that, then the free flow of the milk will happen. Okay. So this is all about the lactiferous duct, alveoli into the alveolus, that is the space from there to the lactiferous duct and going to the lactiferous sinus and opening at the nipple. So there will be 15 to 20 ducts opening into one nipple. So I think you all have seen whenever a mother is pressing, it is not just one stream that is coming out, lot of streams will be coming out, right? So because of the lot of ducts present within the breast. So now coming to the physiology. So till now we have understood the structure, how the breast is, and its extension, how the ducts, lobules, alveoli are present. So this alveoli, I forgot to tell you one thing. Within the alveoli you can see some cells, right? Those are known as alveolar cells, which will be secreting the milk into the alveolus. Okay. So these alveolar cells are surrounded by some cells called myoepithelial cells. So the oxytocin will work on this myoepithelial cells so that they get contract and the milk will be secreted into the ducts. Okay. Now coming to the physiology of lactation. So how the milk is being produced and how they are coming out. So the development of the breast into its functional state is known as mammogenesis. Okay. Then secretion and synthesis of milk is known as lactogenesis. Then let down of the milk, that milk coming out of the breast is known as galactokinesis. Kinesis is movement, right? Genesis is formation. Kinesis is movement. So coming out of the breast is known as galactokinesis. And poiesis is maintenance. This milk is produced just after the time of delivery. It should be maintained till the mother is willing to breastfeed her baby. Whether it is 6 months, 1 year, 2 years or 3 years, it depends upon the mother. If she is willing to feed, the milk will be coming out. So that is called maintenance of the milk production, that is known as galactopoiesis. And after the cessation of the breastfeeding, the breast tissue will go back to its normal pre-lactation state, that is known as involution. Okay. So now what are the hormones that are helping in the for this mammogenesis, lactogenesis, galactokinesis, galactopoiesis? All these 4 things should be understood. It's not just the genesis is happening like that. So all of you know that physiology means it is all about the hormones. These hormones are working on the receptors for the whole thing to happen in the body, right? So now we need to understand what are the different hormones that are helping in different stages of the lactation. Okay. So coming to the first thing, coming to the mammogenesis. So mammogenesis begins just after the child is born. You know that breast is present both in males and females, right? But it is rudimentary in males. In females, it becomes active or it gets developed because of what hormones do you think? What are the female hormones you know? Estrogen and progesterone. Very good. Estrogen, progesterone. Okay. So when the baby is coming to her puberty, when the cycle is about to start, menarche is about to start, and after the menarche, there will be every time, for first 14 days there is estrogen dominance followed by the progesterone dominance, right? Then withdrawal of the hormones, menstrual bleeding. So this cycle is happening within the ovary as well as in the uterus. So these hormones, whenever there is rise in the estrogen, there will be development of the ducts. Okay, I will show you, sir. See here, whenever there is, so when an estrus cycle, you can see the third picture is the estrus. So the ductal development within the breast, I said the breast is stroma, everything, muscle, everything, but there is gland and ducts, right? So the ductal development is helped by estrogen. So every first 15 days, ductal development will happen. Okay? Then alveolar development will by the progesterone. But this is not too much till the mother is conceived. Once the mother is conceived, the effect of the estrogen and progesterone will predominate when she is conceived, because not only the ovary and the uterus are producing these hormones, but also placenta is coming into action, right? So again, even the placenta is also producing these hormones. As a result, the breast development will be more faster when the mother is conceived. Okay? So when the mother is conceived, the breast is going to develop better because of the hormones called what hormones? Estrogen and progesterone. What is their source? What is their source? Not only ovary, uterus, now what is other thing that is coming into action? Placenta. Now you should understand how a human body is being made, how God has created our body. Whenever we need something, so whenever there is a conception, placenta is there, placenta is producing the hormones, those hormones is developing the breast tissue. So we are getting ready to breastfeed the baby, right? Okay, so that is the role of the estrogen and progesterone hormones. So now coming to the lactogenesis. So now the development of the breast is being happened. So this will be continued till the birth. Till the birth, okay? The progesterone domination will be continued. Then the lobules, alveoli will be growing. And at the time of the birth, what happens? Placenta is removed at the time of the birth, right? So now you think what happens to the estrogen and progesterone? Will their effect will be there in the body or not? Yes? No. Menstruation is not there. So ovary becomes cessation. Yes or no? For 1.5 to 2 years, ovulation will not happen. Uterus is completely occupied by the baby. Yes? So there is no role of ovary and the uterus during the time of pregnancy and lactation. Because menstruation will not occur, na? Okay. So that you remove now. There is no estrogen, progesterone from there. Then what happens to the other estrogen coming from the placenta? Placenta is delivered right after the baby. So estrogen, progesterone are there or not? No. So as the delivery is happened, there will be complete decline of the estrogen and progesterone because the breast has already been developed. Development is happened. Now the function of the breast is what? To secrete the milk. So now other hormones are coming into action. Okay. So those hormones are prolactin. Okay. So from where the prolactin is being produced? Ekkada? Brain, body, ekkada? At least tell me from which structure it is being produced. So I'll read the red sentence. Estrogen stimulates growth of the ductal system of the breast. Progesterone is required for the full development of the lobule-alveolar system. For the milk to be formed, we need other hormones called growth hormone, prolactin, adrenal glucocorticoids and insulin are also helping. But we need to talk about the prolactin and oxytocin. So the whole physiology of lactation, you need to think only about two hormones. Prolactin and oxytocin. From where they are produced? From the pituitary gland present just below the hypothalamus. Nobody knows among all you, nearly your 40 people? Then why you didn't answer me? So now tell me, breast is somewhere down and prolactin is produced somewhere, how it is going to help? It is endocrine organ, right? So what is the hormone? Hormone is produced somewhere and reaches to the place where it is to be acted. Okay? Okay, now, so already estrogen and progesterone have gone down. Okay? Now think. So now prolactin is coming into action. So prolactin is present since the pregnancy has started. But because of the dominance of the estrogen and progesterone, prolactin is not acting too much on the breast to produce milk. But little effect of the prolactin is there even during the pregnancy. As a result, you know during pregnancy, if the few mothers are pressing their breast, they can see some white golden liquid. Anybody knows about this? Did any mother talk to you about that? I'm pregnant but I'm having some secretion from the breast. Is this normal for me? No? So now you will get such questions. Okay? So that is normal because little prolactin is acting and colostrum is being produced right from 5th month of the pregnancy. Okay? So this is normal. You can tell mother this is normal because it will not produce copiously. It will be something 2 to 3 ml. Whenever she presses little liquid she can see, which is very normal. That is what you have to assure to the mother. Okay? Which is very normal because of the action of the prolactin during pregnancy. Now you have to see this. See this graph. Now once the delivery of the baby is happened and delivery of the placenta is happened, then what is happening? The estrogen and progesterone will go down. Now the prolactin action will come up because there is no inhibitory effect of the estrogen and progesterone. It has no inhibition now. Now prolactin can come and act. So whenever the mother sees the baby just after the delivery, touch the baby and first feed. So when should be a first feed to be given to the mother? Within normal delivery and section delivery. Within half an hour. Within half an hour of the delivery, even within the labor room itself, once the cord is cut, take the baby, keep on the mother's chest. Let the baby will take the milk or not is a secondary thing. Just take, once the cord is cut, keep the baby over the chest of the mother. That is within half an hour itself, the breastfeeding should be started. Once the baby is trying to touch the nipple of the mother, then this touching of the baby to the nipple of the mother is the stimulus for the mother for the prolactin to be produced from anterior pituitary or posterior pituitary. Prolactin. Very good. Now you are into the line. So prolactin is produced. So what this prolactin will do? So the action of the prolactin will rise in not from the 0 but it will rise within 1 to 24 to 48 hours. So you all might have heard, elders will be telling grandmas, it will take some time, milk will come in, it will take some time, 1 or 2 days. So this is because the prolactin should be acted upon the alveolar cells for the milk to be produced, secreted, synthesis should happen. Okay, so synthesis should happen. So for that the time being taken. But before that, what is helping the baby then? Once the baby is born, it starts crying, right? It needs food, yes or no? Then how the baby is getting survived for this 24 hours or something like that? Because we have hormones are like that. They have to come, act, then secrete milk. So I have told you already, there is some prolactin acting from the 5th month of the gestation, which is secreting the colostrum, the golden yellow milk, yes? So that golden yellow milk of the colostrum is enough for the baby to feel satiety of the baby. That much, the 2 ml, 3 ml, 10 ml is enough for the baby because it is very much rich in lactose. It is rich in lactose and there is 0 fat in that. So easy digestible. Okay? And not lot amount of water, but the concentration of the nutrients, immunoglobulins and carbohydrates are rich in the colostrum. The 2 ml, 3 ml is enough for the baby for that first 1-2 days. But the further stimulation of this, the prolactin to come more and more, what we have to encourage the mother. So that is the reason I am going to tell you all these things. Actually, finally what you have to understand is when to start the breastfeeding, how frequently the mother should be given to the baby. The baby should feed on the mother. It is very frequently, every 2 hours you should encourage the mother to feed the baby. Whether the milk will come in or not is a secondary thing. Okay, that little colostrum will be coming, the baby will be feeling okay, but the mother should feed the baby very frequently, nearly every 2 hours. Okay, every 2 hours, this will set in the prolactin hormone to be released from the anterior pituitary and work on the lactiferous glands and mammary gland and the ducts. Okay, so that is the reason why the baby should be given to the mother within half an hour. And your 1 hour answer is for the cesarean section. Okay, that is for the cesarean section. Even the section mother also nowadays we are encouraging within half an hour only. The stitches will be taken down and the baby will be given to the mother on the chest. So that is how now the things are being changed. Okay, so now you know that what is the function of the prolactin now? Synthesis of the milk or production of the milk, and it is secreted from the anterior pituitary. All the way it is coming in through the blood to the mammary gland, and there it is synthesizing the milk. Okay, so now milk has come in, that is lactogenesis has been happened. So now There are 3 stages in this lactogenesis, that is stage 1, 2 and 3. What is stage 1? That is just initiation, where the colostrum is being produced. Okay, that is initiation where the colostrum is being produced. And when there is a stage 2 which is known as milk coming in, that is within after the 24 hours. After the 24 hours, if the mother is feeding the baby very frequently, then milk will come in into the breast. From the colostrum, the milk is going to the transition milk. So this 2 days to 14 days, the milk is known as transition milk. Okay, what it is known as transition milk. And how much it is being produced? Can anybody guess? How much baby wanted, that much it is produced. As the baby is feeding, the milk is being produced because prolactin is being secreted, right? Okay, prolactin will be secreted. So how this prolactin, once the baby is feeding on one breast for 15 minutes, one side, and 15 minutes on the other side, let us suppose half an hour, these signals of the feeding, suckling reflex, or these signals are going to the anterior pituitary, and prolactin is being produced and acting on the breast for next feed. So this feed, the baby is giving the stimulus, the milk will be formed for the next feed. So for the next feed to be formed and the milk to be produced, whether the gland should be vacant or it should be filled with the breast already. Breast ఖాళీ ఉండాలా, ఫిల్ అయిపోయి ఉండాలా నెక్స్ట్ ఫీడ్ రావాలంటే? ఈ ఫీడ్ ఖాళీ చేయాలా చేయొద్దా నెక్స్ట్ ఫీడ్ రావాలి అంటే? That means how it is getting freed or how the milk is. So every feed is very important. This feed, if the baby is taking out the milk, then now the breast is ready for the prolactin to act for the next feed. So that is why the breast should become free. That is what we will tell mother. Give both sides, one after the other. Give, and milk will be of 2 types. Initially, it will be of first 10 minutes, it will be of the fore milk followed by the hind milk. If both milk are being fed to the baby, then only the baby is going to gain weight. The first feed will be rich in carbohydrates and water. The last feed will be rich in fat. That will be creating the satiety to the baby. As a result, the few babies will sleep better and few babies will not sleep. Usually they urinate and they get up, they cry. The reason is the mother is giving only the fore milk. That is the reason. They are not getting satiety. So we have to encourage mother till her breast is becoming loosened. Till then she has to feed. Okay? If she is not able to feed 2 breasts together, one after the other, ask her to take some gap and feed the next breast initially first. Okay? As the baby is growing, both the breast baby will be taking. This first 14 days it might not take 2 breasts together, but if the mother is feeling heaviness in another breast because she has fed one breast, she can express the milk. She has to first vacate all the milk from her the breast so that the prolactin is going to act and the feeding is going to be, milk is going to be produced. So this is about the prolactin reflex. So prolactin reflex or milk producing reflex is known as the sucking of the baby, sending the signals to the anterior pituitary, and the prolactin is being produced, that is going and acting on the breast to produce the milk for the next feed. Okay? So now milk is produced. How this milk is coming out? Is it coming out if the baby is just sucking, or it also needs some hormone? Yes, it also needs some hormone. What is that hormone? Oxytocin hormone. So now we are coming into another reflex called milk ejection reflex. Milk is increasing. Then after 14 days there is stage 3. So how much the baby wanted to feed, that much milk will be produced. Okay? So this is one of the capability of the human, that if 2 babies are born, mother can produce milk enough for the 2 babies. So it is only the stimulation baby has to give to the mother, that is the prolactin production, and oxytocin reflex, that is the ejection. If these 2 things are normal, then mother can feed 2 babies together, no worries. So this is what you should know the information. A mother can feed even 2 babies, then why for 1 baby only she is having problem? So the reflex which has to be initiated and continued is not being happened properly. Oxytocin and the prolactin production. So there we have to come into action and make the mother to understand that the release of the prolactin is more important for the production of the milk. So how it is, all things will be understanding in the positioning and latching. So you have to, here what you have to watch out is for the engorgement, that is excessive milk production, having pain or those things, and change in the milk, because few mothers will be asking you that my milk initially was thick, now they are becoming thin, is there any problem, am I not producing good milk? No, it is a normal thing. Okay, initially we are having colostrum rich milk, gradually it is going to transition milk, then it is going to mature milk, there will be a transition. So it is okay. And also there is a little difference between the hand milk and fore milk, that also you should know, so that you can encourage mother, or you can give confidence to the mother, this is normal. So when you can say normal, when you have knowledge, right, when you know what is actually happening into the body. Okay, so there is a hand milk and fore milk, there will be some difference, there will be transition of the milk from the colostrum, transition milk and mature milk. These things you should tell mother, these are quite normal things, don't worry. Okay, you should assure mother. And how much milk supply? It can be from 250 ml to 1.5 liters or more in a day. So if a mother who is having very good prolactin reflex, she is producing lot of prolactin, you can encourage her for the donation, because a baby cannot drink 2.5 liters at a time, so she can actually express and donate for the other mothers or other babies. So you should know why a mother can actually donate a milk, because if she is having a very good prolactin reflex, she can produce lot of amount of milk which will be wasted, so she can donate. Okay, it has raised and it is being continued. Is it like that? Girls, please see that graph and tell me, is the prolactin is once it is raised and is it continued, or it is coming to the base and again rising? How the graph is? It is stable. It is stable. Of course it is stable. But is it falling down and rising? Yes. Why it is falling down and rising? When it is rising, whenever the baby is sucking, prolactin is rising, and whenever the baby is not sucking, it will fall. Okay. So that thing you should know. It is not continuous. So whenever you are telling the mother, you are educating the mother, you should know. Not always it will rise. One thing. And also, if a mother is not producing enough milk, if she is complaining you and you have expressed and checked amount of milk is less, you can tell her that feed the baby in the night between 3 to 5 a.m. which is the very good time for the prolactin to be produced. Okay, early morning 3 to 5 a.m. If she is taking the baby around that time and feeding the baby, then the production of the prolactin throughout the day will be enhanced. Now coming to the kinesis, that is the expression of the milk or let down of the milk, which is given by the oxytocin hormone. So this oxytocin hormone, it's not like prolactin, now it is produced, so it is acting for the next feed. This oxytocin is not like that. The stimulus for the oxytocin is also baby suckling only. Okay, stimulus for oxytocin also baby suckling. This reflex is going to the posterior pituitary and oxytocin is released, which act on the breast within 30 to 60 seconds. So initial 30 to 60 seconds, that is 4 to 5 sucks or 10 sucks, baby is not getting milk. Okay, so that is why we tell mother, express few milk and rub it over the nipple areola area and then keep the baby. So the baby is encouraged to feed. It feels some taste, right? So that is the reason. So this oxytocin is coming from the posterior pituitary and acting on the myoepithelial cells, contracting the cells, releasing of the milk from the alveolus into the duct and then sinus and coming out. So this is called oxytocin reflex. Not just alone prolactin will help, even the oxytocin also should come into action for the let down to occur. Okay, so both hormones. So oxytocin you also know it is called happy hormone, love hormone. Yes. So whenever a baby, mother is holding a baby, will she be happy or she will be moody? Happy. So that is why this is all because of the oxytocin hormone. This happiness is also some encouraging for the hormone to be produced. So let down will happen better. So poiesis is maintenance. That means regularly the mother should be encouraged to feed at every interval of 2 hours so that the prolactin will be coming up, production is happening and oxytocin is released and milk is coming down. So now poiesis means it is maintenance of the lactation. Every 2 hourly the mother should feed the baby. And how do you know that baby is getting enough milk? How do you know the mother is getting enough milk? Huh? Baby is sleeping. Okay. Then, because to educate mothers, you should know whether the baby is sleeping with full stomach or it is having low glucose levels and the baby is sleeping off. You should know those things. It is not that simple to say baby is sleeping so it is getting full enough milk. It's not like that. Okay? Then how do you know that the baby is getting enough milk? So you know prolactin, oxytocin, everything it is working. Then how does you know the baby is active? Even it is sleeping. You should ask mother how many times the baby is feeding and how many times the baby is urinating. Okay? If it is not more than 6, then the baby is not getting enough milk. The mother is feeling that she is feeding the baby, but she is not feeding the full stomach of the baby because baby is not getting enough carbohydrates or glucose, it is sleeping off. There is no energy, no glucose in the body. So these all things you have to take care when you are going to educate the mother or observe the mother, okay? If the baby is sleeping, it doesn't mean that baby is getting enough milk, okay? How much time she is giving and also how many diapers she is changing or how many cloths the baby is wetting. All these things you should take into consideration. After 14 days, you should even take into consideration the weight of the baby. Every day, how much the weight of the baby should be increased? 20 to 30 grams per day. It is a very good weight gain, that is 20 to 30 grams per day. Less than 20 is only median weight gain. It is not apt. These all things you should know. After 14 days, you should inquire about the weight gain of the baby also. Not only the changing of the diaper, but also the weight gain should be considered, whether the baby is getting enough milk or not. If you are documenting all these things and showing mother that if everything is good, 8 times the baby is urinating in 24 hours, 8 to 12 times the baby is feeding, and there is a gaining of the weight from 30 grams per day, then you can assure mother you are a very good breastfeeder. Okay, that is very good encouragement for the mother for the further continuation of the breastfeeding. Because the lay people, the grandma, mother, whoever by the side of the neighbors, everybody will be telling, I don't think you are breastfeeding properly. I don't think you are getting enough milk. So scientifically you have to tell, yes, you are getting enough milk. The baby is passing 8 urines per day and 12 times it is feeding, and weight gain is also I am able to see. So you don't listen to anybody else. I am documenting this. You can show to everybody. This is there. And by 6th month, how much the weight gain of the baby should be there if the mother is feeding better? Double the birth weight. Double the birth weight. If a proper feeding is happening, by 3 months itself, double the birth weight will get. Okay? But actually it is 6 months. So double the birth weight and tripling by 1 year. Tripling by 1 year. And also, what about summers? What do you think? Now it is very hot summer. Do you encourage mother to give some water to the baby? No, not at all. The water coming from the milk is enough for the baby to control its thirst, to maintain its thirst. Okay? So no need to give any drop of water except a few medicines which are suggested by the pediatrician. Nothing to be given to the baby except the breast milk, which is known as exclusive breastfeeding. This is known as exclusive breastfeeding. So this is all about the physiology. Now coming to the different shapes of the breast. So there is a round, teardrop, bell shape, east, west, side, side. There are different shapes. So we are not worried about any shape actually. Okay. So these are very different shapes of the breast. Why I have kept this slide is, whatever may be the shape of the breast, if the mother is having a menarche, she is entering into the pregnancy, the estrogen and progesterone are working, ductal system is being developed, glandular system is also being developed, then mother can breastfeed. The mother will be having doubt that my shape of the breast is something, so I might not be feeding the baby, I might not get full milk. This is her concern. So whatever may be the shape of the breast, okay, the mother is able to feed the baby. Even few mothers will have very small breast, but during the pregnancy the glandular development will be that much. Even the small breast mothers also can feed their baby exclusively till 2 years or how many years she wanted. Okay. And coming to the, so what are the factors that affect the shape? Are the density, because there may be more fat than glandular tissue. So in few mothers there will be more large breast, in few mothers only the glandular tissue is predominating, not the fat, so there can be small breast, that's all. There won't be any difference in the feeding pattern. And age and hormones, of course the estrogen and progesterone levels do come down as we age, so the breast tissue shape will be changing, it can involute gradually, okay, that is normal, natural, that you have to tell the mother. Even the weight gain will increase the size of the breast, weight loss will decrease the size of the breast, because lot of fat is present in the breast. So coming to the nipples, okay, there are different types of nipples, which is very much important before you should, when you are going to learn about the latching, okay, latching, so you should know what are the different types of nipples. The normal nipples are the protruding nipples, and there will be flat nipples, and there will be inverted nipples, okay. In inverted nipples, grade 1 is without any fibrosis, so we can make it out and feed the baby, whereas in the grade 1, grade 3 there will be fibrous tissue involved in it, so making the nipple out will be difficult. There we might need some instruments, or sometimes if the mother is so much interested towards the breastfeeding, there will be a small surgery also for the fibrous tissue to be removed, okay. Now pseudo inverted, it appears it is inverted, but once the stimulus is being given to the mother, that is the baby suckling, it will come out. And cracked nipple, you all know, did you see anybody cracked nipple? Yes. So if the latching is not proper, and if the mother is frequently washing her breast with the harsh soaps, then the oil will be not properly lubricating the area, so there can be a cracking of the nipple. And also nipple blebs. What do you mean by nipple blebs? So this is the flat nipple, you can see all the pictures. So this is fibrous, what is that, inverted nipple. Then coming to the inverted, flat and normal nipple, you can see the difference. Inverted little nipple will be out, but the center of the nipple will be inside because of the fibrosis, okay. Then coming to the flat, you cannot see any nipple area only, but with the stimulation, flat nipple can come out. Grade 1 inverted nipple also can come out. Those all things you will learn in the next class. So this is the cracking. So there will be small wound type of thing over the nipple area, or even on the areola area also. If the latching is not good, mostly if the latching is not good, cracking is very normal, which will give much pain to the mother. Then this is nipple bleb. So it is nothing but it is the small pustule. It is not the pus, but it is the milk. Stagnant. If the mother is not giving milk for lot of time, or if one duct is not being, the milk present in the one duct is not coming out, so it will get thickened, and that one duct will be formed in the form of a bleb. That is known as nipple bleb. Okay. So these are the different types of nipples. So what is the take home message? Now one question, does every mother can breastfeed after this session? Do you understand that, or only few mothers can breastfeed? So every mother is a potential breastfeeder. Once she is delivering a baby, it can breastfeed because of hormones. Everybody of us, whoever is conceived, pregnant, gone through the gestation period and delivered a baby, will all have their hormones in the normal thing. Only the thing is we should stimulate properly at the right time for the breastfeed to be initiated and to be continued. So do you know that if there is a pain, lot of pain, if the latching is not proper, and if mother is getting lot of pain during feeding, will the let down reflex will be normal or it will be hindered? What is let down reflex? Oxytocin. Milk should come out of the breast. Will it be normal or it will be hindered? It is a love hormone, I told, right? Happy hormone. So during pain, is there any happy? So during that time, if the mother is having pain, the let down will not be normal. She cannot give, the milk is present in the breast, but they are not coming out as much as baby is needed. It will happen and baby will be feeding. Okay. So why breastfeeding is so important? Why are we taking class? Because in the present current world, everything is adulterated. Whatever we are taking, food, water, everything. Only the natural thing that we can give a baby is the breast milk. So everybody of us should work towards, every mother is going to feed her baby exclusively is our motto from today. Okay. So thank you. If any doubts you can ask me.